Staying with us on In Focus on Newsroom Africa Channel 405. Thanks for staying on. Now, as the country's vaccine rollout slows and COVID-19 numbers continue to soar, should we be preparing for the worst, or will we manage the storm? Here to talk to us now, I'm joined by infectious disease clinician and director of the Office of AIDS and TB Research at the South African Medical Research Council, Dr. Fareed Abdullah. Dr. Fareed, good evening and thank you very much for joining us tonight here on In Focus. The numbers in South Africa continue to rise as we speak. 7,600 new infections reported in the last 24 hours, as mentioned in the headlines. What are we doing to exacerbate the situation? But also, is there reason to believe at this time that tougher restrictions would make any difference?
Good evening, Thabo. Thank you for having me. I think it's common cause now that Gauteng is making up the lion's share of the new cases. Over the last 4 or 5 days, we've made up more than 60% of the new infections. Yesterday, 4,800 of those 7,000 infections were in Gauteng. What concerns me is the direction of travel, which points to significant further increases over the next few weeks. So you'll recall that a month ago, the Northern Cape, Free State and the Northwest were the highest case rates. That's a rate per 100,000 population. But in each of the last 3 weeks, Gauteng has overtaken the Northern Cape, the Northwest first, then the Free State, and a couple of days ago, the Northern Cape. So what concerns me more is that we are going straight up. We already exceeded the case numbers of the first wave and the second wave. And if it continues like this, we could end up with twice as many cases per population in this third wave in Gauteng compared to the previous waves.
What are we particularly doing in this province that is exacerbating the situation?
So before I answer that, just to explain that whilst the cases are going up in Gauteng, and they will at least double compared to the second wave, the number of deaths and hospital admissions is still about half of the previous wave. So if it continues to stay low, then we're probably able to cope. But my own instincts are that the number of deaths will catch up with the cases. It takes about 2 to 3 weeks for the death numbers to go up and the hospital admissions to go up. If that happens, then we are going to be in serious trouble. And to answer your question, we need to increase our hospital capacity to take on patients, especially in the public sector.
Now, the question has always been around whether or not we believe, and there's science to support, that harsher restrictions could make a difference at this point. I mean, with those numbers and the trajectory, as you're putting it, is it too little too late now, even if we were to put tougher restrictions, because the infections are already spreading?
I think the people qualified to judge whether harsher restrictions will have a benefit or not have kind of spoken. Even the Gauteng government seems to be inclined to believe that harsher restrictions are the way to go. As a clinician at a public hospital, I can tell you that our concern is to open more beds. Now, to reflect a little bit on that, over the course of the last 16 months, there's been an equal split of admissions between the public sector and the private sector. But this time around, more than 75% of our admissions are in the private sector, which means we really need to urgently beef up our hospital beds for COVID in the public sector. And each hospital can do that. Now, it won't come as a complete surprise to your listeners, because Charlotte Maxeke Hospital, which really is our biggest COVID hospital in this province, is not operational. And what we need to do, and here I'm trying to answer your question, is that we need more nurses. The nurses are the real rate limiting step when it comes to opening more beds. And I'm sure that most hospitals in the province can open more beds, but if they have the additional nurses. So any and all urgent measures in the public sector especially, but also in the private sector, to get more nurses on stream would make a huge difference to making up that shortfall of beds.
Yeah. Now, in 2020, we saw both in the public and the private hospital critical shortages of oxygen. What have we learned from that experience, and what are we doing differently now?
So, Thabo, perhaps I'll be humbled and eat my words, but my own impression, and I've been working with more than 14 hospitals now in Gauteng to help with supplying equipment. We've been looking at the oxygen supplies, and I'm confident that there will be enough oxygen in the hospitals. There will also be enough equipment to deliver this oxygen, whether it's a ventilator, a high-flow nasal oxygen device, or a face mask which comes straight out of the oxygen socket. I know that almost all hospitals have had their oxygen reticulation networks beefed up. At Steve Biko and Tshwane district, which I know very well, all our oxygen points have been checked, and there will be oxygen. In addition, the main supplier of oxygen, which is Afrox, has got 3 plants to supply oxygen in Gauteng. So I don't think that'd be a problem if a patient can get into a bed. So our oxygen problem lies or will lie with those patients who cannot get to an oxygen point. Yeah. And once again, the solution to that is to open more beds. There's one other thing to do, which is for the patients who will not make it into a bed, patients who need oxygen but are not considered to be the sickest, those patients should access a huge network of community organizations in Gauteng which are delivering concentrators. And I had a patient just a few days ago where the hospital wouldn't admit him, and some NGO or some community organization in Benoni gave him oxygen concentrator for 5 days free of charge. There are good people out there doing this. But to answer your question, I think the hospital supply of oxygen is well established, it's safe, and I don't think there'll be a problem. Yeah. It brings us back to the essential nub of the problem, which is we need to open more beds. Yeah. Otherwise, we can't take those patients into the hospitals.
Now, you've outlined how the numbers are growing, particularly as far as the number of infections, but you've also highlighted that so far we're sitting at half when we're talking about the number of in-hospital case fatality risk. Now, if we continue along this trajectory, looking at the number of infections, which have now doubled the first and the second wave. Previously, we reported a rise of nearly 30% in hospital case fatality risk. How far would that number go?
Well, this is the unknown, right? But there are all signs in the statistics, and one is trying to be objective here, are that we could be facing a situation which we've seen in the Eastern Cape in December, we've seen in other parts of the world, where there are insufficient beds. So the beds are full in the hospitals, the beds are full in the emergency departments, the tents that almost all Gauteng hospitals have are full, and then doctors have to choose who to take in and who to send home. That situation is a very real possibility. And it would be the horror that we would want to do everything to avoid. Sending people home, some of whom will die because they need the oxygen, some of whom will survive, but be suffocating without oxygen. And that situation, is not an impossibility in our situation, given the numbers.
Now, the Gauteng Health Department is saying, I quote here, we've made a call to the national government to say, help us, please. What does that mean about where the province is at right now?
Well, basically, we're already in a situation where most doctors in the community or at primary care facilities are struggling to get their patients into beds, whether that's the public sector or the private sector. So the current hospital beds are mostly full. Our ambulance services are being called to people's homes, and they have to make a decision if a patient needs to be admitted to a hospital or not, and they have to often find a bed. So I think beefing up our nursing staff, as I said, will allow each hospital to open up the beds. At Steve Biko, if we had an extra 120 nurses, we could open 100 beds. I'm certain of it.
What about the Nasrec facility? Can it help now?
Well, Nasrec, for one reason or another, has been decommissioned completely because I believe it was a very expensive place to rent. But what has been commissioned, and they already have a few patients, is the Baragwanath Field Hospital. And, once again, it's a part of the solution, but it's not a complete solution. So a facility like Nasrec can take patients who have moderate disease, who need low flow oxygen. But what really will be the game changer in Gauteng is to open high care and ICU beds at Charlotte Maxeke. Now, everything humanly possible needs to be done to fix those fire doors and to get that hospital commissioned. They've just, a private donor just spent 10 million rand beefing up a 40-bed ICU. That's the kind of facility we absolutely must have within days, not in weeks, but in days. National can come to the party by opening up nursing positions, additional posts for doctors, and facilitating additional resources to the provinces.
More beds then is the call from the South African Medical Research Council. This as the Department of Healthcare in the province saying we've made a call to government for help. 124 ICU beds could be available at Charlotte Maxeke Hospital. Currently, they are busy fixing fire doors there. We'll keep a watch on the situation. We'll continue next in the moment. A pending national strike, some warns, but also we speak to the South African Cabin Crew Association when In Focus continues next.